Hello, I'm Dr. Rhonda Johnson. Today is Wednesday, May 15, 2024. Today I'm talking about harm reduction. Well, one of my followers asked me to discuss this. She mentioned that harm reduction services saved her life and are the reason why she's in recovery today. So please know that I don't consider myself an expert on this topic, and this is a high-level overview. So for the purpose of this video, harm reduction refers to an umbrella term for individual interventions aiming to reduce the problematic effects of behaviors that negatively impact health. Now, harm reduction was originally and most frequently associated with substance abuse, recognizing that many people continue to use substances even if the consequences are harsh. But again, this concept can be applied to a multitude of other behavioral disorders. Now, harm reduction practices targeting the individual provide additional tools for people who, for whatever reason, may not be ready or willing or able to pursue full abstinence as a goal. In other words, these harm reduction approaches meet people where they are and support any steps that people take in the right direction. Now, there are many peer-reviewed publications which support the effectiveness of harm reduction interventions. So let's look at some examples. So needle exchange programs and programs that teach intravenous drug abusers how to do safe injection techniques. They may be controversial, but they can reduce the risk of HIV and hepatitis C transmission. Condom distribution programs on college campuses may reduce the risk of unplanned pregnancies and sexually transmitted infections. Naloxone or Narcan access is an example of a harm reduction program that increases access and provides training on how to use Narcan, thereby reversing the risk of death from opioid overdoses. There are harm reduction approaches to alcohol consumption that involves getting to healthier levels of drinking. Let's say you're a person that drinks a 6-pack of beer every day, and a harm reduction approach has you getting to a point where you're drinking a 6-pack of beer over the course of a week. So other harm reduction strategies involve college students who are binge drinkers, and they pair them with students who are not binge drinkers, providing peer and social support. So those are some examples. Another example is opioid substitution therapy, like using methadone and buprenorphine as a substitute for more harmful fentanyl and heroin addiction. So again, these programs may be controversial, but peer-reviewed articles suggest that they are effective. So if you are a practitioner working with clients, is harm reduction the right approach? Well, some experts say it is, depending on where your clients are when they're seeking help. The harm reduction approach helps people make steps in the right direction because everyone may not be able to commit to complete abstinence or what's used to be called cold turkey. The bottom line is success for someone with an addiction may be a reduction in harm rather than a sole focus on abstinence. Abstinence may be the ultimate destination, but harm reduction might be part of the journey. So please consider having a conversation with your mental health counselor or therapist or someone you can talk to if you are a person seeking recovery. That's my message today. I hope that's been helpful. Take care, folks. And you may want to refer to those addiction videos that I did earlier this month for context. Take care.